want you to do actually is lay down for me. And this is the part where you're gonna, if you had a naked patient, you would be looking for an apical pulse, but you're not gonna see it with her. Where would you find an apical pulse?
Mitral area.
Intercostal space, right? You might.
Mitral area.
Right, it's down here, and down in the apex. You're gonna look for the pulse, and you know, for like men, it's gonna be easy because they'll take their shirts off easily and be able to see it. For women, you're gonna have to disrobe them and look for it. Okay. And then I'm just gonna palpate your chest. Maintain her here. Up it all the way down. Move it all the way down here. Nothing hurts you. Okay, now I'm gonna listen. Before you start, at the base. The base is on what side? Right.
Okay.
Tell them which part of the heart you're listening to. Pulmonic, aortic. Okay, go ahead and sit up for me. Now, in your sheets, I'm not sure if it tells you to listen to heart sounds sitting up or lying down. I like to listen to them lying down because I can hear them better. I have a lot of overweight people, so it just is better to listen that way. This is where you would do your breast exam, where I would do the breast exam, and looking for gynecomastia in males while you're on the chest, just do it all right there. Okay, and you know with the breast exam, you're going to have them sit up, you're going to have them lift their arms up, their arms by their side, and then arms here, look for any pitting, dimpling, pulling, anything. When you lay them, when they're laying down, have them raise their arm up over their head, fill all the nodes up into the tailspins. Do your, however you're going to do your breast exam, I do mine circular. Start at the nipple, go all the way around, all the way out. Okay? Then we're going to check your, so now we're going to do the arms. We're going to check your epitrochlear nodes. So Ashley, I'm just going to feel your arms here. You tell me if that's painful there. No. Okay. Fingers are symmetrical. Skin's nice and warm. Cat-free feel. It's less than 2 seconds. Squeeze my fingers. Squeeze real hard. Equal. Okay. Next thing I'm going to do is check your sensory. So if you'll close your eyes, tell me if you feel this. Okay, tell me if it's sharp or dull. Okay. I'm going to go ahead and check your reflexes. Just relax your arm for me. I'm looking for her arm to jump out. And then you're going to check which one is this, girls?
Brachial.
There you go. You're looking for the thumb to kind of poke out a little bit. Do you have reflexes?
Broken. It's broken too.
She's broken. You go down both sides, okay? So we checked sensory, we checked pain, we checked reflexes, pulses, and check your radials. Good. Symmetrical. And check your brachials. And they're symmetrical. Now, I'm going to push down your arms. You pull up, push down, push in. Can you raise your arms up? Can you tuck them behind your back? Can you do your arms like this on both sides? So for conduction, very good. So she's got good range of motion. Okay, take your wrists, move them around. Take your fingers. Can you do this? Forwards and backwards. Good. Now what I want you to do now is I'm going to have you do your hands like this as quick as you can, as fast as you can. Okay, I'm going to do them with my hands. Do it the same way. There you go. Okay, check the cranial nerve number.
Oh, I can't remember. 8. Oh, yeah.
Isn't that 8?
Yeah, 8. It was the auditory one and the...
You're checking for cerebellar function. Okay, Now we're on abdomen, okay? Go ahead and lay back for me, Ashley. And I'm gonna look at her abdomen, and abdomen is flat. She doesn't have a scaphoid bulging abdomen. It's not rotund. It's not over distended. I'm gonna listen to your abdomen, so 1 minute. Start where?
Lower.
Right lower. And go in clockwise fashion. You need to listen for at least 2 minutes, right? If you don't hear bowel sounds, how long do you listen?
5 minutes. 6.
First enough to just say we listen for 2
Is
minutes.
it 6?
You
It's
can say
5.
that. Yeah, you don't have to listen for 2 minutes. Just say I'm going to listen for 2 minutes. And then you're going to listen for her aorta. While you've got this here, turn over to your bowel, listen for the aorta. And I can't hear it, they're closed. But then you're going to listen for your arteries, your renals, your iliacs, and your femorals. Okay?
With which side? The
Huh?
bell? All those with the bell?
Yeah. You're not going to hear them with the diaphragm, they're too deep. What else do you need to do? You're going to percuss this abdomen. It's all very tympanic. And then I'm going to push on your abdomen. Tell me if you feel anything painful. Say, okay. Anything hurt you? Okay, I'm going to go a little bit deeper. Anything hurt somewhere? Your diaphragm is really low. You're very short-waisted to be as tall as you are.
Yeah, my legs are really long and my stomach's fine.
Anything painful there? Now, if they were particularly obese and you're trying to feel liver, you know how to assess the liver? What?
Don't you think you let go, but...
Oh, yeah.
Huh?
I forgot what you were trying to do.
Like put it
Put
on.
your hand behind their back.
Yeah.
Put this hand up underneath the rib cage and ask her to take a big deep breath and then let it out. And if the liver enlarged, you feel it bump against your hand. For spleen, you do the same thing, reach across, stick your hands right behind the rib cage, take a big breath for me, Ashley. Is anything painful there? I don't feel any fullness there. There's no dullness, so you feel dullness over enlarged spleen. If you're wanting to feel the kidneys, you would do the same thing. Have her take a big breath and hold her breath, and then you would feel for anything to roll under your fingers. Okay? Abdomen's done.
Do we have to do liver span?
You don't.
Thank
Not unless
God.
it's on your competency or they ask you
Okay.
to. No. Okay, legs. I'm going to inspect her legs. Look for distribution of hair. Look at the skin. Look for color. Looking for pallor. Any signs of peripheral vascular disease. Any purple, color to her skin. Any petechiae, modeling, anything like that. You would document that. And then check cap refill. Look at the feet, at the skin of the feet. Look for any peeling, any sores, especially if you have diabetic patients. Okay? I'm just going to push on you here. Ashley, tell me if anything hurts. Anything hurt there? Nothing hurts? Okay. I'm going to lift up your leg. Can you bend your leg up for me and flex it all the way in? Is that painful?
No.
Can you lift it straight up in the air? Is that painful? If I push your leg out like this, is that painful?
No.
Bend your knee here. Is that painful? Good. Do that on both sides. You're checking all the motor and checking your range of motion. Okay? Go ahead and sit up, Ashley.
And pulses, right? Feet
No.
pulses.
The pulses I'll do when I sit her up.
Okay.
Okay? Now, can you turn your ankles in? Turn your ankles back out. Any pain there? Ankle, do that fine? I would check popliteal pulses now. Okay, just relax your leg. I'm just going to check the pulses back here. Then you're going to do the trochlea. What are these?
Dorsalis pedis.
No, those are
Posterior tibia.
posterior tibia. I couldn't remember what the name of them was. There, and then dorsal pedalis here. On both sides. Dorsal pedalis. Good pulses. Okay, you're going to do the same thing with the sensory stuff. I'm going to have you know what I forgot to do? Would you guys let me forget to do?
Oh, the Weber Rhine stuff.
Yeah, we'll go back and do it. So tell me if this is painful here. Is it sharp or dull? Okay, we're just going to pretend like you can feel me.
It was a competency.
Huh?
It was a competency.
Oh, that's good. So you don't have to do it. Yeah, okay. You guys know what's on your sheets. I'm just showing you everything. Okay, strength, push your knees in, push your knees out. Pull your legs back, pull your legs forward, ankles up, feet down. Okay, go ahead and stand up for me. Right, I want you to take your leg out to the side, both legs. Any pain? I'll tell you what, why don't you stand here, put your hands by your side, put your feet close together, very close, like touching, like closer. Okay, close your eyes. You want to guard your patient in case they start wavering. She's good. Okay, Ashley, can you tandem walk for me? Walk one foot right in front of the other like this across the floor. Good. Okay, turn around and just walk normal back. Okay, can you bend over for me? This is where I check the spine. Okay, and her spine is a little crooked.
Yeah.
She's
There's
got
a little
a
scoliosis.
scoliosis right here at the thoracic spine. Okay, come on back up. And I always check, which you don't have to, but I always check for equilibrium here in the hips so you can tell if the ischial spines are off. Okay, she's done.
What was your spine?
26 minutes. Good job.